So how do you breastfeed? It's actually a learnt skill for you and for your baby. So even though it's a biological function, it is a skill that needs development. And like anything that we learn, patience and persistence is key, okay? So my philosophy with breastfeeding is to simplify it, okay? And is that there are a few key steps that if women can master these simple few steps well, that they will greatly increase their chance of successfully breastfeeding their baby. So firstly, the most important thing is knowledge, okay? So it's important to understand and to know what you're trying to achieve when you breastfeed. And ultimately, we're trying to achieve a nice deep latch for baby. So if you take your tongue and if you rub the tongue on the roof of your mouth just behind your teeth, and then take your tongue and take it further back to the back of your mouth and have a feel at the roof of your mouth there on the soft palate and have a little feel of the difference. So behind our teeth, it's actually quite hard, but when we take it back further, that soft palate there is much softer. So where the soft palate is in baby's mouth is actually where we want our nipple to go, okay? And that's what's going to prevent that damage. So when the nipple's just behind baby's gum, that is where nipple damage occurs. So there's two reasons for this, obviously, as we've just discussed, to prevent nipple damage and prevent pain when breastfeeding. And the second thing is that baby actually receives much higher volume of milk when the nipple is further back in the mouth than if it is just at the front. So baby's not using up all of this energy to just get at this small amount of milk. They're actually getting a good amount of milk that's going to fill them up more effectively than nipple feeding. So first steps to breastfeeding, always skin to skin first. And that sets baby up for all of their reflexes being turned on so that they attach well and then nutritively suck and swallow. So putting baby on your chest, skin to skin, talking to your baby, calming your baby, letting your baby know we're here and we're ready for a feed. So to position baby well, one of the first steps is making sure that baby's tummy is touching your tummy. And what this does is it means that then baby is facing you. Now, if we think about us as adults, if we were to have a drink of water, and if our tummy was facing out this way and we were trying to drink over here, that would feel really awkward and we would not be able to drink well. Whereas when we have a drink of water, if we sit straight and drink, it's much easier. Okay, so it's the same thing. You want baby looking and baby's body aligned straight on to mum, okay? So that their neck is not turned and twisted. The second thing is, you may have noticed when I just pretended to take that drink that I extended my neck, and that kind of looks like I'm smelling. So having baby also extend their neck is going to help them to drink and suck and swallow easier, okay? And what that also does is it clears baby's nose and airway so that they can breathe nice and easily. Now, babies are designed to be able to breathe even with their nose, kind of embedded in the breast a little bit, but it's just much easier for them if their neck is extended. So the next part of aligning baby up for a good feed is lining baby up so that they actually looks like that they're smelling your nipple. Okay, as opposed to nipple to mouth, we're going to go nipple to nose. So the mouth actually comes onto the areola and not the nipple. And then the nipple will flick back into the mouth when baby starts to suck. So once you've lined baby up perfectly this way, it's then important to remember not to disturb that alignment by you then moving to put your breast into baby's mouth, but putting baby up onto your breast and bringing baby to you. And once baby is attached, then it's just good to do a quick reassess. So have a look at your baby. Is your baby sucking with their jaw? Can you see their jaw actually moving? And can you see them swallowing or hear them taking gulps? Another good sign is that baby's got this gorgeous double chin happening and that you can't see much of your areola, that most of your areola is hidden in baby's nice wide open mouth. Another good sign is that you're comfortable and not experiencing intense pain. Now, I will say that at the start of your breastfeeding journey, a certain level of discomfort can be normal. However, it should be bearable. So if the pain is really unbearable, pop your pinky finger, a clean pinky finger, inside baby's mouth and detach the latch and try again. Now, it's better to try again and get a good latch that doesn't cause damage than to feed through it and then have sore, painful nipples that may disrupt your breastfeeding journey altogether. So pain most of the time means that baby is not attached correctly and that you may need to try again. But a mild level of discomfort that will either ease or that's really easily bearable may be normal, and then over time your nipples and your breast kind of become accustomed to feeding, and that will dissolve. And so one of the things that I noticed in my clinical experience is that women often, after they have a baby, are so tired and so overwhelmed from the birth that it's really easy to forget a lot of this breastfeeding advice. And I want to be very clear that in the first couple of hours in that first feed, that babies should just kind of be left to explore on their own, especially if you've had a nice normal birth without any intervention or synthetic drugs or anything like that. Babies have this inbuilt ability to look for the breast. And so that's really important, that your baby can just spend time doing it on their own with your gentle guidance. But you may like to remember these easy steps for successful breastfeeding in your postnatal journey. So we've come up with a little jingle that you might like to either write down the main points of or record on your phone so that it's really easy for you to remember when you're breastfeeding how to attach baby with confidence.
Tummy to tummy, smell the rose. Nipple to nose, and on she goes. Have a look. Is she using her drawer? Are you comfy? Or are you sore? Well done, Mama. That's the way. If you need to try again, then that's okay. Tummy to tummy, smell the rose. Nipple to nose, and on she goes. Have a look. Is she using her drawer? Are you comfy? Or are you sore? Well done, Mama. That's the way. If you need to try again, then that's okay. Tummy to tummy, smell the rose. Nipple to nose, and on she goes. Have a look. Is she using her drawer? Are you comfy? Or are you sore? Well done, Mama. That's the way. If you need to try again, then that's okay.